Well, it's time for our Africa 54 Health Report. Joining us now is health correspondent Linord Moudou with a look at Nigeria's tradition of medicine. Hello, Linord.
Hello, Vincent. Hello, everyone. As obesity and other chronic diseases continue to grow in Africa, more and more people are turning to traditional herbal medicine as an alternative treatment. The Awolowo market in Lagos has existed for decades. Here, herbal medicine healers carry on the traditions passed down to them for generations. 83-year-old Iyaloja is the head of the market.
We will treat any kind of disease that is affecting anyone, and the person will be okay. Doctors do operations on people, but we do not do it. This is the only thing we use for them, and they will get better.
While some Nigerians turn to traditional medicines because they are affordable, others say they use them to lose weight. In a Lagos suburb, the Quincy Herbal Slimmers Laboratory and Factory sells Quincy Herbal Slimmers, a locally packaged weight loss product. It is a creation of Quincy Olasumbo Ayodele, a herbal medicine practitioner who comes from a long line of traditional healers. She has been practicing for 18 years.
Here in Africa, they always think that herbal medicine has this stigma that is fetish, it has spirits, and I know that there is no any other spirit apart from the medicinal spirit in medicinal plants. So I had to now try to make sure that I come out with the ones that will be acceptable.
Quincy uses her grandmother's herbal remedies to lose weight. People visit the health centers seeking for treatment for issues ranging from obesity, fibroids, skin disorders, diabetes to high blood pressure. Ayoade Tolulope is a caterer based in Lagos.
I feel when you're with people that actually know what they're doing and this is what they've done and people have actually seen results, you feel more comfortable with them than just going to the gym.
The program is designed to help the clients change their dietary lifestyle and also includes an exercise regimen. Clients pay about $400 for a 1-month program and $1,250 for a 6-month program. Started in 1996, the company is now worth about $5 million. Tobi Ayodele, Quincy's daughter, is the director at Quincy Medical Center.
By making sure that everybody that is a consultant at our practice have that knowledge in the medical aspect, it allows us to better help our clients and better allow us to give more accurate and positive results. Herbal medicine in general, we still need more research in trying to standardize our dosage, standardize our practice. We try our best to do that based on evidence-based practice.
Scientists warn that the use of traditional medicine can be dangerous if administered incorrectly. Dr. Odunlade Albert Kolawole is a researcher at Yaba College of Technology. He says inappropriate dosage could damage certain organs in the body.
Actually, when you look about the herbal medicine, many of them can have effects on the livers. I'm talking about the overdosage of it. Livers, kidney, and some internal damage. But if you package it very, very well, they might not have a side effect.
Despite the risks, the use of traditional herbs and medicine is likely to continue as more people seek alternative treatment to both existing and new health problems. For more on the subject, we are joined by Professor, Researcher and Consultant, Dr. Cyrus MacFoy. Professor MacFoy is author of the book, Medicine Plants and Traditional Medicine in Sierra Leone. Dr. MacFoy, welcome to the program.
Thanks for having me, Linord.
It's good to have you here. Listen, we saw in the report that, first of all, 2 different settings where people could get traditional medicine in the market and also in a clinic. Would you say in general, what would be the best approach in terms of finding traditional medicine? Because there are some people out there who are skeptical about their effect, actually.
Yes, I agree with you. A lot of skeptics do exist out there. But my own take on it will be that either setting would be fine if they have met all the necessary prerequisites. They've done all the research, they've done all the standardization, the dosage, the storage facilities, and all that has been taken care of. Then that drug, once it has passed all those guidelines, should be okay.
So, because one of the challenges really is quality control. with regards to traditional medicine, with modern medicine, there are some protocols that we know that pharmaceutical companies have to follow. But when it comes to traditional medicine, how do we know even that this herb is the right one to use?
Unfortunately, that is part of the problem with traditional medicine. And a lot of countries are now developing national policies to address all these issues. So those countries which are ahead and have got to the stage where they have definite policies, definite regulations, are okay. But those who are on the road to developing those kinds of policies, I don't think they should be putting out products like that out in the market before they get all the clearances that are necessary.
Absolutely. Now, we know that traditional medicine is clearly part of African society, African culture, has been there for the longest time. What do you make of the way people are using it today? Do you think it still has the impact or maybe the importance that it used to have back then, or perhaps modern medicine has taken over?
Well, I'd say that the mere fact that about 70% of Africans still rely on traditional medicine means it has some impact in the country. Only a very, very tiny percentage of the country have access to modern medicine. So if 70% of your population depends on it, it definitely does have some impact. Obviously, like with anything else, and I think I mentioned that earlier on, research has to be undertaken so that we are sure of what we're buying in those stores or we're given by this herbalist. They have got to be authenticated. They've got to have the right dosage and the right storage. And if they meet all those prerequisites, those drugs should be okay.
Now, in your book, the book that you wrote, you give a very compelling detail of some plants and what they do, what they are good for, especially in Sierra Leone. Tell us about how this is received, the traditional medicine in Sierra Leone, in the communities in Sierra Leone. What is the impact there? What is the role still as of today?
As in most of the African countries, there are two systems. You have the traditional medicine system, and then you have the orthodox system. And I must reiterate myself that a large percentage of our population still depend on traditional medicine. And so they have no alternative. They cannot afford it. It's not accessible. It's expensive. And therefore, they just rely on it. And okay. And especially since we have a wide cornucopia of plant species throughout the forest of Africa, Sierra Leone included, so you could see that we have the resources there. It's just developing it and make sure it meets certain prerequisites, certain guidelines to be followed, certain standardization to get all the profiteering charlatans out of the streets who are making money out of poor people, sometimes without any knowledge of the plant or its efficacy.
Okay, Dr. MacFoy, thank you so much for joining us. That's all the time we have today.
Thank you so much.
And that's Dr. Cyrus MacFoy. He's author of the book Medicine Plants and Traditional Medicine in Sierra Leone. And that's our Africa Health Report for today. Back to you, Vincent.
Well, thanks a lot for being with us today. Be sure to watch Linord Moudou's Health Reports every Tuesday and Thursday on Africa 54.